but they also sent it's called letter of medical concern. And I guess in this, we're going to provide commentary about how to not have an unbalanced approach to health. Last week, actually, I got a notification from an insurance company. It was affiliated with a service called Express Scripts, if any of you are familiar with that. Not that I'm calling Express Scripts out. They all do this.
Oh, yeah. They denied me.
Well, kind of. They did deny something, but they also sent it's called letter of medical concern. So, of course, being a discerning provider, I said, well, let's hear them out. Let's see what they brought up about this particular patient. Some generic background is this patient has type 2 diabetes, and this patient has previously been on metformin. So this patient would meet criteria for a GLP-1 receptor agonist, and apparently had not been diagnosed with type 2 diabetes as far as the ICD-10 code, but was a known diabetic. So I sent a prescription for a GLP-1, and this was not approved. And instead, the letter of medical concern, instead of saying, we are concerned this patient is not on a GLP-1 yet, because the latest A1C was 7.7, said this patient should be on a statin. And as people know, I am certainly not anti-statin. But I thought that it was ironic that they would not cover that medication. Instead, I feel like they should have the letter of medical concern, because this patient actually went to the pharmacy and paid out of pocket for the GLP-1. They are not cheap. So you're welcome, pharmaceutical company. You're welcome, CVS. And I guess you're welcome, insurance company. Even though you're trying to ding me, it's actually the insurance company's dysfunctional medicine algorithm that brought this situation up.
That's interesting. It is a reverse Uno card situation where they are not meeting the evidence-based standard of care and then trying to point the finger at you for not having the patient on a statin, or every provider that had seen this. Presumably this patient's been diabetic for some time if the A1C is at 7.7.
Yep.
And I remember when I was a kid, I don't know how old, but I was told if you point your finger at someone, you have 3 fingers pointing back at you. So that's why I always point with my hand like this.
So you have 5 fingers pointing back at you?
Pointing only at the other person and none pointing back at me.
I see. So it's not like that.
Yeah.
Oh, that's a good one. So I guess on the topic of statins, you would think that since insurance companies are sending you letters about how this patient needs a statin, with no qualms, they should cover every ApoB test that we order. Or do patients have to pay out of pocket for that test that is proven to be a better monitoring than
That's right,
LDL?
because this isn't the first time you have received a letter from I guess Medicare is technically an insurer. Your experience in ordering ApoB tests, which I probably wouldn't be aware of if we weren't, reading the journals, if we weren't following other podcasts where this is mentioned time and time and time again. But going back like several years ago now, you had made it sort of a practice to order an ApoB test because they're the accepted standard of care in Europe, in JAMA cardiology, in lipidology. Mm-hmm. It's a much more accurate and reliable predictor of who's going to have a future cardiovascular event. So what happened when you started ordering these tests for patients?
Yeah, I got a similar letter, I guess also of medical concern and also financial concern about maximum amounts of money and maximum amounts of tests that this insurer was willing to pay. This was much after the articles that you referenced were published. I guess even though it's after hours, we can still provide references. A lot of times in our posts, our listeners or followers say, well, where is this source or where is this reference?
Documents.
Yeah, where's the documents? And a lot of times, if you just listen to the podcast, then we'll note the documents. The article from JAMA Cardiology, I believe it was published in November of 2021. And I think it was a Dr. Alan Snyderman But there was a whole bunch of authors. The title was "The Debate is Over. ApoB is better than LDL for monitoring, blah, blah, blah." So the standard of care is set, but they don't cover it, but they still want to make sure that, I guess, instantly after your diagnosis, you're on a statin, because that is somehow an acute med. So I think that's all I need to say about this. It was a bit dysfunctional, and there's a lot of cognitive dissonance among the insurance companies and what they're willing to pay for.
Yeah, and there's a lot of, pointy fingers. Why is the cost of healthcare so high? And there's a lot of moving parts there. Maybe we dive into that another time.
Yep.
But having the idea of, algorithmic medicine, that's definitely the way that insurers, at least for their first line, they just follow a simple yes or no, this medication is preferred or not preferred.